Welcome to Anatomy and Physiology for Speech and Hearing. This is Shanna Stack, and I'll be working with you guys on Chapter 6, Part 2, Anatomy of Articulation and Resonation. I don't have video today, but I think this is going to work out really well anyway. So we're going to go over the muscles of the face, and you'll see a long list here. So we're going to walk through each one independently. So the first one we're going to talk about is orbicularis oris, and it's actually a muscle that wraps around the upper part of your lip and your lower lip. Okay, so it kind of makes a circle. So I think of or like the O in oris as a circle. It's a circular muscle that surrounds your lip. So that's called orbicularis oris, and you can also think of oris as an oral, if that helps you relate the two. And you don't need to know, at least in my class, I don't ask students to learn the origin and insertion, but I do want you to know the category, its relative location, its function, and its function here, and then its name, of course. So I would require you to know the name, orbicularis oris. I would require that you know that it's a muscle of the face, where it's located, and that it constricts the oral opening. Origin and insertion are sometimes helpful when you're trying to determine relative location or function. So if you think about muscles as being mechanical, basically they only move in one direction, on one plane. They either shorten or lengthen, right? So if you know the origin and insertion, which means the attachment points to other either bones or soft tissue, you can help to decipher what that function is without having to memorize it. So I always give the origin and insertion just to help students learn it rather than memorize the functions and also the relative location. But if it's not helpful, you don't need it. All right, the next one is risorius, and you'll see here. So this picture we're looking at is just a lateral view of. So this picture here, just a lateral view of an artist's rendition of a human being, and you'll see this is anterior, and then this is posterior here. Okay, so risorius. Think of this muscle as just all it's gonna do is shorten. Okay, it's this muscle right here. And when it shortens, it's going to pull the corner of your mouth, which is right here, completely back. Okay? So that's its only job really, is to retract the corner of the mouth, like a grimace almost. Okay? And it might be helpful to think of these as facial expressions too. So you could, I did this, but I'm kind of a silly learner, and some of you guys are too, I'm sure. Just look in a mirror and make different facial expressions and try to determine what muscles you're using. It's really helpful in terms of consolidating what you're learning. All right, then we get to the buccinator. It's a deep muscle, so it's right here, and it's also right here. It actually, if you put your tongue inside your cheek and push, you'll feel the skin in your mouth, and then right just deep to that skin, that mucosa, you're going to feel the buccinator muscle. So it's a deep muscle, and then you have the risorius lying over the top of it, the platysma. So you have the risorius lying over the top, platysma, and masseter here. Okay, so it's a deep muscle, and it helps primarily with mastication, with chewing food. So it holds food onto your molars while you chew, but it also constricts the oropharynx. So, and oral means mouth, and pharynx means throat. So it's two roles. And when we get into muscles of mastication, buccinator will come up again. But the space between your molars and your cheek is called the buccal cavity. And I also think of if you blew air into your cheeks, like you were bugling. I'm pushing air into my buccal cavity, which is next to my buccinator muscle, when I bugle. So that's just one other way of remembering that silly name. All right, levator labii superioris. Some of these names are going to tell you exactly what they do, and when you know what they do, you can kind of determine where they're located. So here's levator labii superioris. So levator means to elevate, right? And if you think of this muscle here, when it constricts, it's going to shorten from this direction and move up, okay? You'll see that the fibers are running lengthwise this way. So, and labii means lip, okay? And then superioris is above, right? So this is the muscle that elevates the lip from the superior direction, from above the lip, okay? So it tells you exactly where it is and what it does, and it elevates the upper lip. Okay. Now don't get levator labii superioris, which is right here, and zygomatic minor mixed up. They both have the same function. Okay, they both elevate the upper lip. However, zygomatic minor is more lateral compared to levator labii superioris. So I think of levator labii superioris as my Elvis muscle. Elvis, how he just lifts up the one side of his lip. He's isolating the right levator labii superioris when he does that. Okay, so I think of that as my Elvis lip, and then zygomatic minor is just a little bit lateral to that. Okay, and then there's another muscle called the zygomatic minor that we're going to learn in just a minute. Okay, so here's your zygomatic major, and just think that you remember your zygomatic bone. It's right up here. Okay, so you got to think, well, where is my zygomatic? This is actually the temporal process of the zygomatic bone. Remember learning that? And then here's the zygomatic process of the temporal bone. Okay, so it has a muscle attachment here on the zygomatic bone. Okay, and then the orbicularis oris is the other attachment. So when this muscle shortens, just think about it logically, think about it mechanically. When it shortens, it's going to retract the lip kind of superiorly and laterally, right? So kind of like I call it my smile muscle. Okay, so my zany zygomaticus is really silly. That's kind of how I remember. Zany things are funny, and in order to smile, you need your zygomaticus. So remember, minor and levator labii superioris are close to each other, and they have the same function. Here's levator labii superioris. This is zygomatic minor, and they're buddies. Okay, they're married. And even though zygomatic minor and zygomatic major have similar names, they have different functions. Okay, the zygomatic minor helps with the Elvis lip, where zygomatic major helps with smiling. All right, so then we have levator anguli oris. Okay, and you'll see it right here. So it's kind of cut away on this side, and it's going to draw the corners of the mouth up and medially. Okay, so medially is this way, right? So it's going to help you purse your lips. And then orbicularis oris constricts the oral opening, right? All right. Then we have depressor labii inferioris. So just like levator labii superioris, we have a depressor labii inferioris. So what do you guys think it would do? It's gonna pull the lower lip down, okay? And it tells you exactly where it is. It's below the lower lip, okay? So it dilates the opening of the mouth, which is the orifice, by pulling the lips down and out. All right, and then we have depressor anguli oris. I call this my frowny muscle. It's this guy right here. Okay, it's gonna depress the corner of the mouth and compress the upper lip against the lower lip. So if you're squeezing your lips together. All right, I call this my bird poop muscle. And you guys might not know this analogy, but when I would pout as a little girl, I would stick my lower lip out and wrinkle my chin. And like a pouting face. And my grandma and my mom would tell me that if I did that, a bird would come through on my lip. And so that's why it's the pouty muscle, really. But anyway, that's how I remember it. And so it elevates and wrinkles the chin. And you remember the mental region and the mental symphysis that we talked about earlier? This muscle lays right over the top of the mental symphysis, and it's right in that mental region, right? So they all go together. All right, then we have the platysma. It's a very thin, superficial sheet of muscle, okay? And as we age, this muscle becomes less toned and more flaccid. And so you kind of get it just becomes, you can just see it. It just doesn't look as strong, I guess. But its job really is to depress the mandible. Okay, so it's this thin sheet of muscle, and you can feel that if you ran your hands underneath your chin and down the front of your neck. That's your platysma. All right, now we get to move to muscles of the mouth. So all of those were muscles of the face, and you want to categorize them that way. Okay, muscles of the face. Now we're moving to muscles of the mouth. Okay, so we're going to work on the tongue. The tongue is your primary articulator. It's the one articulator that does most of the work in terms of producing your speech sounds in an intelligible fashion. So we're going to name the different portions of the tongue. So first we have the apex over here, okay, which is the same thing as the tip of your tongue. Then we have the body, okay, and then the superior aspect is also called the dorsum. So think of your tongue like a dolphin, and you know how dolphins' backs are where their dorsal fins are. That's how your tongue is set up. The dorsum is the superior aspect. So think of this as the head of the dolphin. This is the tail of the dolphin. Okay, and then the root of the tongue is right down here. Okay, so this is anterior, and then this is posterior. Okay, and then the inferior surface is where your lingual frenulum is, and we'll look at that in a minute, but that's just this right here. And then there's another picture up here for you guys to look at. All right. So, but your tongue is actually divided into right and left halves by this thin sheet of connective tissue called the median fibrous septum. And so, I don't know if you guys have seen this, but I used to watch like Ripley's Believe It or Not, and there was a guy that cut his tongue down the middle, and it looked like a snake's tongue, and he could articulate each side of his tongue independently. And that's because of this median fibrous septum. He didn't cut the muscle, he just cut between the muscle into this connective tissue and was able to separate the muscles because they're paired on each side. So it's pretty wild and cool. So there you go, median fibrous septum. Okay, here's your lingual frenulum. So you may have a patient, usually a child, that has that's maybe tongue-tied, and basically the lingual frenulum is still adhered farther, farther towards the apex of the tongue to the floor of the mouth. Okay, and then here are the sublingual folds. And lingual is another word for tongue. All right, so this is a superior view. Basically, if you cut off the top part of the patient's head and you were just looking down on their tongue, this is what you would see. Okay, so let's start down here. Let's start here. This is the apex, or the tip of the tongue. Okay, then this is all the dorsum of the tongue. Remember, dorsum is superior. And then here's the central sulcus. Okay, and that's right below that is that that connective tissue that I was just talking to you guys about. Okay. All right. All right, so muscles of the mouth. In my class, you need to know the name, location, category, and function. So the superior longitudinal muscle is this muscle right up here on a mid-sagittal view. Okay, it's the most superior muscle of the tongue, closest to the dorsum. It's also here. This is a coronal view of the tongue, so it's paired on each side. And it's separated by that median fibrous septum, that connective tissue that I was talking about. Okay, and it does a number of things. It elevates the tip of the tongue. Okay, so when this muscle contracts, it elevates the tip of the tongue, and I would just recommend you elevating the tip of your tongue now, so you kind of get the kinesthetic feel. Elevates the tip of your tongue, assists in retraction, moving the tongue back, and also helps deviate the tongue to the right or the left. Okay, so it does tons and tons of things. So retraction, elevation, and deviation. Right? Then we have our inferior longitudinal muscle. Okay, so it's best seen in this coronal view here. So it's paired on each side. Okay, it pulls the tongue tip down. and then also assists in retraction and deviation. So the only difference between the inferior and superior longitudinal muscles of the tongue is that the superior elevates the tip, whereas the inferior longitudinal depresses the tip of the tongue. Otherwise, they both assist in retraction and deviation. And their location is obviously different. See, we have the vertical and transverse muscles between the two, kind of sandwiched between the two, kind of like, peanut butter and jelly. All right, so let's get to the vertical muscles of the tongue. They're intertwined, so you'll see kind of cross sections in this picture. Just consider right now that we're talking about the vertical lines. Okay, that's just indicating these vertical muscle fibers. Okay, when those vertical muscle fibers contract, they shorten in this direction. Okay, and when they do that, they pull the tongue to the floor of the mouth. Just think of this muscle basically flattening out as these fibers shorten. Okay, and then the transverse, the fibers run this direction. Okay, more on the horizontal plane. And just think when they shorten, okay, they come closer together, so this muscle now becomes kind of narrow and tall. So they narrow the tongue. Okay, so the vertical flatten the tongue, whereas the transverse narrow the tongue. All right, now we get to move to extrinsic muscles of the tongue. So basically, if it's an extrinsic muscle of the tongue, it's a muscle that has one attachment point outside of the tongue. Okay, and the first one is genioglossus, and it has a number of functions. So I call it the genie of all tongue muscles, because I think genies make dreams come true and they can do anything they want. This is the most talented muscle of the tongue, and so it's the genie. And I'm sure there's some root for genie, but that's just how I remember it. And then glossus is another word for tongue. So it does a number of things, and here it is. So this is a mid-sagittal view. Here's anterior. Here's posterior. Here's the dorsum of your tongue. Okay. Here's where your mental synthesis would be. Here's the epiglottis. Just to give you a little bit of orientation. Okay, so if this muscle has anterior fibers and posterior fibers, and then when the two work together, they have a whole nother function. So the anterior fibers, when they shorten, they pull the tongue back. Okay? They retract the tongue. Now the posterior fibers, when they shorten, this is not the best picture of the genioglossus. When they shorten, they pull the tongue forward. But if both of them are kind of working against each other, they depress the tongue. Okay? So the anterior fibers pull the tongue this way, posterior fibers push the tongue out, and then together, when they work together, they push the tongue down. Okay? The genie of all muscles, the tongue muscles. All right, then we have the hyoglossus. And so think of hyo as alluding to the hyoid bone. Okay, so it has its origin is on the hyoid bone. Okay, so here's your hyoglossus muscle. It's a thin sheet of muscle that connects to the lateral body of the hyoid and the greater cornua. Remember how the greater cornua kind of wraps around this way? Okay, so here it is. And then it's also inserted into the inferior longitudinal muscles. Do you remember those? Those muscles, they help with depression of the tip of the tongue, retraction and deviation of the tongue. Remember from just a few slides back. So it's inserted into that muscle, and when this muscle shortens, so this sheet of muscle, it pulls down the sides of the tongue. Okay. All right. The next one is our styloglossus, and I'm not sure. I hope we talked about. I don't know if we talked about the styloid process, but it's right here, and it's a part of the temporal bone. It's just in front of the mastoid process, and I call it the stylish styloid. And then so its origin is the styloid process, or here it says the palatal aponeurosis. Oh, sorry, I'm talking about the stylo. I got excited about the styloglossus, I guess. Oh, hold on. I think I went back one. Sorry guys, I clicked it and then I thought, man, I thought I was talking about the styloglossus. Okay, so back to the styloglossus. So its origin is the styloid process, which is right here, okay? And then it's attached to the underside of the tongue, the inferior surface of the tongue. So when this muscle shortens, okay, think of it, it's going to draw the tongue up and back. It's just going to pull the tongue towards that styloid process, which is actually right behind your ear. So I think of the styloid process as kind of like an earring behind your ear. All right, finally, paloglossus, this guy right here. Okay. So it's attached to your soft palate and the sides of the posterior aspect of your tongue. So it has two functions depending if the velum is contracted or not. So if the velum is contracted, if it's the steady point, the origin essentially, then it's going to elevate the tongue. But if the tongue is more contracted, is more of the steady attachment point, then it's going to pull down the velum. So it just depends on what other muscles are contracted, on whether or not it's going to, depress the velum or elevate the tongue. All right. So the next one we're going to talk about is chondroglossus. Okay. So this is another muscle that is connected to the hyoid bone. It's actually connected to the lesser cornua. Okay. The muscle. You remember you had the body, then the lesser cornua that kind of sticks straight up, and then the greater cornua that just looks like an extension of the body. So this muscle is attached to the lesser cornua, and then kind of is just sort of sewn into the medial aspect of the tongue. So when this muscle shortens, it's just going to pull the tongue down. Okay. All right. Now we're going to move into muscles of mastication. And you'll see we have mandibular elevators and then mandibular depressors. So elevator means to bring the mandible up. Mandibular depressors mean to move them down. And you'll see some overlap between muscles of the face and muscles of the mouth and face and muscles of mastication. So mastication is the ability to chew food and form a bolus. And a bolus is essentially chewed food that's mixed with saliva, and it's kind of formed into a nice little cohesive unit that's ready to be swallowed. So, and when my puppy was little, that's what he did. He ate all my shoes. So I'm sure you guys have had an experience like that when he was learning how to masticate. So, so the mighty masseter is right here, and actually, if you put your hand on your jaw, maybe near the angle of your jaw, and kind of just chew, like you don't have to have anything in your mouth, but just bite your teeth together. You should feel a muscle contract. That's your massive masseter, and it's one of your primary muscles of mastication, and it elevates the mandible. Okay, so it's this guy here. Its origin is the zygomatic bone here. Okay, and then its insertion is on the mandible. So on the ramus, remember, is that branch, and then the cornoid process. Remember that muscle attachment we talked about? We had the condylar process and then the cornoid up here. All right, temporalis it basically covers your temporal bone. Okay, and when this muscle shortens, it elevates the mandible, and it also is attached to the cornoid process, if that helps. Elevates the mandible, okay, and draws it back if protruded. So if you pretend you had a class 3 malocclusion and you had an underbite, and then pull it back, your temporalis is helping with that. So put your hand up on right above your ear in your temporal region, and you should feel that. And then protrude your jaw and pull it back. You should feel your temporalis contracting. All right, medial pterygoid. So do you remember we were talking about the sphenoid bone? And we have medial and lateral pterygoids. So those were the bony attachments for these muscles. And so you can go back to those slides too and look at the sphenoid again if you want. But here's the medial pterygoids, okay? And then the lateral pterygoids here. So the medial pterygoids elevate, and it's really such a 3D muscle. If you guys want to Google medial lateral pterygoids, that's probably a good idea, and just kind of get a 3D picture of it. So they elevate the mandible, but if there's unilateral contraction, there's contralateral movement of the mandible. So if you say you contract your right medial pterygoid, you're gonna move the mandible to the opposite side. Okay. All right. Same thing with this one. However, the lateral pterygoid protrudes the mandible. Okay. All right. Now we get to move to digastric. It has an anterior and posterior belly, so we're going to talk about the anterior belly. So it's right here, and there are better pictures. There's better pictures in your guys' book. So I would look up the digastric in your book, and just so you get a better picture of it. The anterior belly pulls the hyoid forward. Okay, so your hyoid going forward, and depresses the mandible in conjunction with the posterior belly of the digastric. So let me see if we have that one. Here's the posterior belly. So this is a better picture of the posterior belly of the digastric. Okay, so it pulls the hyoid back and depresses the mandible in conjunction with the anterior belly of the digastric. Okay, all right. Then we have the mylohyoid muscle. So it's another one of these muscles, and we call it the lower triangle, but it's right underneath your chin. And it depresses the mandible as well. So these are all mandibular depressors. If you just organize them as mandibular depressors, you only have to memorize one function. Okay? And then, remember how we had the genioglossus? We also have a geniohyoid. And it also depresses the mandible. So, and you can see it's just a little bit superficial. It's more superficial than the mylohyoid and the digastric, and it's actually more of like a thin sheet of muscle, whereas the digastric is kind of a thin, beefier muscle. But the mylohyoid and the geniohyoid are kind of thin sheets of muscle. All right, now we get to move to muscles of the mouth, specifically the velum. So we have velar elevators, depressors, and then eustachian tube dilators. So here's a picture of a patient's or rendition of a oral cavity here. Your uvula, hard palate, velum. These are actually your fascial pillars. You have an anterior. Here's your posterior fascial pillar, anterior fascial pillar. Those become more important later when you get into swallowing. So there's some orientation for you. This is your buccal cavity. So your buccinator would be right here. Okay. All right. So so your soft palate is also called your velum, and we talked about that a little bit. But it's not your velum is not just one structure, right? It's a combination of structures. So it's a thin sheet of connective tissue, which we call aponeurosis. And it's also nerves and blood, nerves, and it also has vascular system that attends to that, and then is also comprised of a number of muscles. So your palatal aponeurosis. So here's a picture, and this pink line is actually depicting where that palatal aponeurosis, that connective tissue is, and it forms the mid to front portion of the velum. And also, it allows for insertion of muscles to manipulate that velum. Okay. So let's begin with the levator veli palatini. This is a mid-sagittal view. Anterior is over here, posterior here. Here's levator veli palatini. Okay. So when this muscle shortens, it's going to elevate and retract the posterior velum. So here's your velum. Okay. So just think of when this shortens, what it's going to do. Okay. Then we have the musculae uvulae. It's actually kind of a component of your uvula that, remember, you can look. And I encourage you at the end of this lecture to get out a mirror and take a look inside your mouth or inside your friend's mouth. But when this muscle contracts, so this is the uvula, here's the tongue, here's the epiglottis, so this is a posterior coronal view. Okay. So this is your oral cavity, this is the base of the tongue, the very back of the tongue. This is the laryngeal vestibule. Before it ends, if you went in deep to this, you would eventually hit your vocal folds and then your trachea. Okay. So when this muscle contracts, it shortens the vela. Computer's thinking here.